I'm Leonelli. I'll be your PA student today,
Nice
performing
to
your cardiac physical examination. I'm gonna go wash my hands.
Great.
All right. So we're going to start off this examination by inspecting your neck. So if you could just put your left for me, please. I'll be using tangential lighting, looking at your carotid arteries and your jugular veins. All right, and looking at the sign as well. Thank you. All right. So now I'm going to locate the area, or the sternal angle, which would be about 5 centimeters below the sternal notch. Get about right there. And then I'm also going to locate your area of oscillation for your jugular vein, which should be about right here. Good. All right, and using my handy-dandy ruler and another straight object, so I'll be measuring the distance from that to the horizontal point of the sternal angle. Perfect. All right. I'm going to palpate for your carotid arteries on both sides. So I'll fill this one for you. Good. Then this one. Good, you're not dead. All right. Now I'm also going to take a listen using the diaphragm. All right. And if you could just take a deep breath and exhale, and then hold your breath for me. That'd be great. Good. All right. Do this one more time, please. Awesome. All right. So now I'm going to. So actually, if you could lay down for me, please. All right. I'm going to inspect your precordium for any for the apical impulse, and also for any lifts or heaves. And then I'm going to palpate the area as well for any thrills. So doing it there with my ulnar surface, and then here as well. If you just displace your left breast upward for me, please. And then right there, the intercostal area. Good. All right. So now I'm going to take a listen to your heart.
All right.
I'm going to
The old ticker.
The old ticker. I'm going to use the diaphragm, but in other cases I would also use the bell. So we have the second right intercostal space in the right sternal border. Second left intercostal space in the left sternal border. Third left intercostal space in the left sternal border. Fourth left intercostal space on the left sternal border. If you can displace your breast upward for me, please. Fifth left intercostal space on the left sternal border. And then the fifth left intercostal space at the mid-clavicular line. Good. All right. And actually, before I take these off, I'm going to listen for S1 synchronization with your carotid artery. So I'm going to listen right here, in the left sternal border, and then palpate. Awesome. You could right between S1 and S2. Just what we want to hear. All right, so now I'm going to locate your PMI, your point of maximal intensity.
Okay.
You can turn your left side for me, please. Thank you. All right. So if you displace your breast upwards for me, please. Thank you. Should be about right there. Good. All right. Then if you lay back down on your back for me, please.
The fly.
Oh, fly.
Yeah.
All right. So I'm going to palpate the area of the point of maximal intensity, or impulse, actually. Go right there. And then I'll also use my ruler to measure the distance between the PMI to the mid-sternal line. Should be right there. Perfect. All right. And actually, before I forget, I'm going to take your radial pulse now because I'm already doing some of your carotid or vascular stuff. So let's see. Let's take a measurement. I get very pulse here, strong pulse. All right, ready?
Thank you. Yep.
I got 66 beats per minute.
Nice.
Right now I'm going to also palpate both of them real quick just to make sure that they're happening. Pretty good. All right, now just for some special maneuvers. So if you can actually just like swing your legs out for me, please, and just sit upright for me. Perfect. Now I'm going to have you take a deep breath and then exhale, and then hold your breath.
Okay.
And then I'm going to auscultate down the left sternal border.
Okay.
And then I want you to lean forward for me, please.
Okay.
And I'm going to listen for any aortic murmurs.
Okay.
All right. And I'm going to be using the diaphragm. All right. Just take a deep breath for me, and then exhale. All right. Exhale. You can breathe if you like. There you go. I'll do it one more time. I don't want you to hold the breath too long.
Okay.
All right. Whenever you're set. Good. All right. You can breathe almost.
Okay.
Now, actually, I want you to lay on your left side for me, please. And then I'm going to auscultate the apex of the heart, which would be at the left intercostal space, the mid-sternal line, or mid-clavicular line, to find any mitral murmurs, or listening for any S3 or S4 sounds,
Okay.
using the bell.
Okay.
So, if you can just, keep going for me, please. Good. All right. And then lastly, you can sit up for me again. I'm going to have you do the Valsalva maneuver, bearing down. So I want you to sit there and act like you're trying to poop.
Okay.
All right, and then hold your breath. And then I'm going to listen down the left sternal border as well, using the diaphragm, checking for any my hair. Alright, well, let's have you bear down first while I think about it.
Okay, sounds good.
Alright. And if you just bear down for me, please. Yes. Good. You did a good job. Alright. And I was listening for any wouldn't be aortic. For any aortic stenosis possible. I'll say that right now. Alright.
Okay.
So next,
Yep.
we're gonna go do your peripheral arteries.
Okay.
We're gonna expect those. Alright. So
Yeah.
I'm gonna look at your upper and lower extremities, noting if you could actually pull up your pants for me,
Oh,
please.
yes.
There you
So
go.
sorry.
Perfect. Thank you. Checking for looking the size, looking at this symmetry or any swelling. Note anything on the upper or lower extremities.
Okay.
I'm also checking for any vascular or venous patterns, actually. So now I'm going to palpate using for any checking the temperature and texture of your upper and lower extremities. All right. And I'm gonna palpate with doing that, doing the temperature and then texture.
Okay.
Then temperature and texture. All right.
Okay.
And let's see. Now I'm going to check the popliteal pulses on both sides. All right. Here. Get in there.
Yeah.
Good. All right. Gonna check your tibial pulses. There we go. And then now I'm going to also check your dorsalis pedis pulses. Oh, low battery. There we go. Perfect. Now I'm going to check your upper and lower extremities for capillary refill. So you might take out your time for me,
Oh
please?
yes. So sorry. Well, they're painted.
They're painted, so I'm sorry. So I would check here. All right. Good. All right, for your hands as well. Good. All right. Now I'm going to check the dorsal of your foot for any swelling. Don't know anything there, or anything in the area above your medial malleolus. Don't know any swelling or pitting edema. Also checking your shins for any pitting edema or swelling. I don't note anything there. And lastly, I'm going to do your lungs.
Okay.
All right. So if you just sit at the edge of the examination table for me, please. And I'm going to be checking the anterior aspect first, which will be a total of 12 areas. I'll be using my diaphragm. All right. And if you just take a deep breath every time I place my stethoscope. can just place them back down if you'd like. One more. Perfect. Alright, now I'm going to do the posterior side, so you can swing your legs out that way for me, please. Oh, perfect. Alright, and this side there'll be a total of 14 areas of auscultation. Alright. And same thing with the breathing, please. And one more spot. Alright, good job. And then if I didn't note this earlier, I would also have used my bell for auscultating the heart areas. And that's about all I got.
Alright.
So thank you.
Yep, you're welcome. Thank you.